What's the best treatment for under-eye wrinkles and crepiness? Can you recommend a solution to the horrible crepiness and wrinkling under my eyes? Please don't say CO2 laser. $6,300 later and it did nothing. Laser was not effective, and I was also told a lower bleph isn't an option as I have no fat in that area, so I would get hollowing and an unflattering roundness to my eyes. Retinoids had little effect also. There has to be a way to address this. It's awful and so aging.
Thank you for your question. You're asking for the best way to treat under-eye wrinkles and crepiness, and your question clearly communicates your frustration with the laser treatment that you had undergone with the CO2 laser, and that you've clearly gotten some opinions about blepharoplasty, which might result in rounding of the under-eye area. Well, I can tell you that as a practicing cosmetic surgeon, I'm a board-certified cosmetic surgeon practicing in Manhattan and Long Island for over 20 years. My background is also in fellowship-certified training in oculofacial plastic surgery. So eyelid surgery and eye rejuvenation has been a center of my practice for over 20 years. And I can certainly understand your frustration. This is a challenge in our field for a variety of reasons, but I would also present the understanding that when the majority of treatments have to do with some type of thermal energy, there is naturally a limit to what that thermal energy can accomplish. In the 90s, we were using the original very aggressive CO2 laser, and it created a lot of good tight results, but it also unfortunately in many different hands created undesirable results. And so then the pendulum swung towards less aggressive lasers such as the erbium laser, which I'd used for many years. But the one thing that observation that I made over this time frame is that when I looked at people who came for consultation, like yourself, and they would always recount a history where they did a chemical peel at one point, they did one type of laser, then they did another type of laser, and essentially at a certain point their skin was even thinner than it had started. And that's where the challenge is. So for the past several years, in our practice, we have been in the forefront of certain regenerative medicine technology that we've been using to help people like yourself. Now, it's not necessarily a cure, but we have been able to help people with something called platelet-rich plasma. The idea is that if we just look at the basic issues with aging, what happens to the skin? The skin loses collagen, it loses blood supply, it becomes irregular, and when we are healing, let's just think of wound healing, you get a cut, what happens? You have to generate new collagen, you have to generate new blood supply. And so we're basically using the technology that your body already has and concentrate it, and we inject it under the skin. Now, it's not a one-time treatment generally when someone has as much crepiness as you're describing and as your photo presents, but we have seen that with strategic placement, we've been able to significantly improve skin quality without going to lasers. Now, in the modern world, people want quick results and they want immediate results. And this is something that you have to understand is not possible. When you are treating skin, I say it's comparable to muscle building. You want to treat, get a result, and then build on that foundation. You can't make the skin beautiful overnight. There are certain limitations, especially when someone has reached a certain age or has had a certain amount of sun exposure, and or they've been smoking. I mean, you have to kind of eliminate a lot of the potential toxic reasons for the crepiness. Now, it doesn't mean that everything can be resolved so easily with just one treatment, but it's a very significantly beneficial modality that can make a difference. So with that understanding, think about regenerative medicine. We've also done this with PRP and acellular matrix, which is something we use for hair loss. We don't necessarily place it under the eyelid at the same concentrations, but we found that essentially we're trying to build rather than heat. Very often when someone's skin is a little bit thicker, or if it makes sense, we'll combine the effect of the PRP with the benefit of laser at the same time. So with that understood, I understand your frustration, but learn more about this modality and see what you can do from a more holistic approach, because clearly there's only so much you can do to build the collagen, and that is certainly a frustrating thing. But I agree that I would not recommend more and more lasers, because you're probably not likely to get a significant improvement. So I hope that was helpful. I wish you the best of luck. Thank you for your question.